today we are thinking about the theme of collaborate, connect and create impact. So what I want to do is talk to you a bit about how we achieve UpCourage objectives by collaboration. So I want to give you some really good and meaningful examples, hopefully, of how we collaborate together to deliver UpCourage. But also, as you know, I work in the NHS and have worked in the MOD, which means that I'm a realist. And so with that comes me wanting to talk a little bit about what our limitations are in terms of the impact we can have. Now, that's not to be a negative Nancy, that's just to help everybody understand what our remit is. Because if we all know, we're all prepared, and then we can help manage the expectations of the veteran community as well. Because what we really, really don't want to do is create more rejection, more abandonment, and more confusion. So it's really great to have a platform here today just to talk to you a little bit more about us. And then finally, I want to put it into context a little bit about the impact that we do have. So I'll share a little bit of data, and then end on some good news and just help you to understand a little bit about the direction of UpCourage for the next couple of years. So I'm hoping that most of you here today are familiar with us. Just in case you're not, I will just really run through who we are and what we do. So UpCourage is an NHS service, so it is delivered by the NHS, but it's delivered in conjunction with some charity partners to deliver a really holistic option and offer, which makes us actually quite different from a lot of other NHS services. But it's also a national programme, so anywhere in England, doesn't matter where you are, if you're a veteran, a non-mobilised reservist, or a service leaver within 6 months of your discharge date, you will be able to access UpCourage anywhere in England. So now, as you can see from the map, England is split into 6 different regions. Of course, we're here representing the east of England. And what UpCourage does is we provide assessment for mental health conditions, and where appropriate, we will provide care and treatment. So our specialism, what we are really, really good at, is understanding military life, and therefore looking through a lens of has military life contributed to how this person is presenting today, and do they need us to walk alongside them to help them through their mental health recovery. In some cases, the answer is actually no. Military service hasn't played an impact, they maybe don't really need us, in which case, great. We'll pass you on to the local services that are there for you, and we'll help you find the right thing for you. But in a lot of cases, which is kind of why we're here, is to help those veterans and reservists and service leavers who really struggle to understand the mental health system out there, or who have tried multiple different therapies but just it hasn't stuck. And sometimes having somebody who understands moral injury, who understands that feeling of being dropped by the forces when you're no longer useful anymore because you need to be medically discharged, that kind of thing that really sticks, that sometimes you need somebody that knows exactly what you're talking about to help the therapy or the intervention get you through to the other side. So we do have some really great specialisms, but we are not here to duplicate mental health services. So I'll go into detail a little bit about that shortly. But what I did want to start with is collaboration, when this catches up. Here we go. So, although UpCourage is a national programme, as I said, each region operates ever so slightly differently because of the geography, because of the different charity services that might be available in that area. So for us, this is what we look like. We're made up of 6 wonderful organisations that all work together to deliver one same objective, which is to improve lives of veterans. So Essex Partnership University Trust, who I'm employed by, we are the lead provider, and we work in conjunction with Norfolk and Suffolk Foundation Trust, who bring a whole host of veteran mental health experience along with them, and have some wonderful impacts within our UpCourage service. So they specialise in looking at mental health stabilisation programmes, just for example. And then we've worked with 4 wonderful charities. So Mental Health Matters, they are excellent. They have very good experience with delivering support lines, for example. So they provide us with a bespoke veterans 24/7 emotional support line. They also provide us with the referral line. So again, UpCourage, although being an NHS service, rather than an NHS administrator picking up the phone and the veteran speaking to that person for the first time and getting quite a quick, perhaps a rigid response. They get a charity worker who's got the time to allow that veteran to really start that journey and open up. Really helps get that person into the NHS in a more tailored way. We then work with Walking with the Wounded, who you've heard from today. So they provide us with some psychological therapies, but they also provide us with some fantastic veteran liaison support officers who do some of that stuff in the background that helps us to get that person's mental health moved along. So of course it's not all about throwing tablets and therapy at people, it's also about what else is it that's maintaining that person's position. Are they feeling so stressed and down? Are they struggling to engage in other treatments? Because actually, as we talked earlier on about Maslow's hierarchy of needs, actually the thing that's the main priority for them at the moment is the housing or the finances or the other difficulties going on. And that's where having charities that have got so much experience with working on the ground with day-to-day difficulties in a non-clinical and non-NHS get you in, get you out kind of way, that's what helps to make Op Courage really, really work well and collaborate together. We also have St Andrews Healthcare, who have some incredible experience with working with the more complex end of the spectrum for veterans' mental health care. So we can see that veterans have gone from various different providers to try and get the thing that works for them. We have some veterans with some really, really complicated service history, layers upon layers of different things. And St Andrews bring that expertise to get to the bottom of that. We also finally work with the Warrior Programme, who offer a really, really unique kind of resilience, goal-building programme for veterans, which again is a really nice alternative to a kind of rigid clinical offer, but it's something that helps veterans to look at what's my next identity? How can I have one foot in my military identity, but now one foot in civilian life? So anybody that has worked in big organisations or with multiple organisations, anyone that's led lots of different groups of people will understand that having lots of different people involved in to achieve one single objective can be really, really tricky. And sometimes it can be a case of too many cooks. We get it right, I think, in East of England. Of course, I'm biased, I'm going to say that. But as we've heard earlier on from one of the group exercise we did earlier, the wonderful thing about veterans work, veterans mental health care, is that there is a can-do attitude. So within Op Courage, there's no room for ego. We're not here to elevate only one option or one charity. We are all here to say, aha, right, you bring that skill, you bring that expertise, how can we all work together to get the best for the veteran? And that's what I'm so proud of about Op Courage, is the collaboration that we demonstrate. And so these are some of the things, we're not going to go through all of them, but these are some of the things that we can offer our veterans and that we can achieve together. So whilst there is the clinical, the typical NHS stuff that you would expect on there, you know, the kind of perhaps some advice about medication, perhaps some therapies, perhaps some diagnostics, sort of like emotional regulation support. You also have the other aspect that I told you about, the kind of the socioeconomic stuff, the kind of the non-clinical stuff that can also really help that veteran to move forward. So employment support, advocacy is a huge one. And things like support with Armed Forces Compensation Scheme claims, for example. We also work very collaborative with whatever, it's after lunch, you know what I'm saying. We work together, there you go, with our sister services as well. And it's not uncommon to have one veteran perhaps open to 3 different op services at the same time. But we try to make that not as unmessy as possible and collaborate with each other. So you'll often see us all in each other's meetings, talking, helping veterans to move into what they need and back again. So again, there's a lot of collaboration going on. As I said though, there are some limitations on the impact that we can have. And we see this quite often actually, that Op Courage is kind of seen as sort of the one-stop shop for veterans, the holy grail, right? Oh wow, there's one service now that any veteran with a problem, doesn't matter, they can go to Op Courage and Op Courage will fix it. It would be great if we could do that, but sadly, we can't. And so we have to be realistic and say that not every veteran can be treated by Op Courage. And I just wanted to give you a little bit of an understanding as to why that is. Because as I said, what's really important to us is not contributing to that cycle of people don't understand me, I can't find the right help, I'm being rejected, I'm being abandoned. So I just wanted to put it into context that we can't provide a replication of all mental health services. Now, being a veteran, that's a demographic. That's not a diagnosis. So there is no one treatment option for a veteran. So whereas you would have, the easiest way to describe it, I think, is sort of general health services. You would have a cardiology specialist for the heart, you'd have a neurology specialist for the brain. But you're asking to deliver an entire mental health care service to one demographic, but they're not homogenous. You've got every single mental health condition underneath that same demographic. So how do you create a team that can deliver absolutely everything? You just can't. So, as I said, our specialism is understanding military life and understanding the impact that can have. And so everything we try to do is with a trauma-informed lens. So what we are really great at is providing trauma therapy, but we cannot do absolutely everything. And so, but sadly, a lot of people think that we can, and then veterans can sometimes be very disappointed. Maybe they've been referred by somebody else, expectations get raised, and then we have to say, I'm really sorry, but, and that's the worst conversation to have. And obviously, veterans talk to each other. So what happens, they say, oh, Op Courage, pants, and that stops somebody else from coming forward. So yeah, what I want you to take away from today is Op Courage does an incredible amount of work, but it isn't a one-stop shop for everything. So as I said, because we're more generalised in terms of we can help assess somebody, we can help them understand the system, we can help maybe find the right place for them, and in some cases we can offer some specific support. What we can't do is replicate really specialist services. So what we often find is we get quite a few referrals from people saying, I think I might have ADHD, can I get some assessment and treatment? I think I might have autism. They are highly specialist fields. We can't replicate that. But yet, that person's now come to us, now they've got to go for somewhere else, and it's just another stepping stone, and you can understand why veterans are so frustrated, because they cannot get what they need easily. Same with drugs and alcohol, highly specialised treatments for addictions, and we cannot provide that safely. We do not have the resources for that. Same with other specialisms, dementia, eating disorders, psychosis, personality, all of these kind of things, they require specialist services. So what people sometimes forget is that the NHS, local services, or Courage aside, the NHS is commissioned to deliver healthcare to everybody. It's not everybody minus veterans, it's everybody. So really veterans should be accessing their local services, but where they can't find the right treatment or where they might be confused about where to go, they can come to us and we can help them work out what is the right pathway. But we don't want to sell ourselves as being the one that's going to fix everything, because we have to be realistic. So also as well, as I said, our expertise is with understanding service and with understanding trauma-informed care, but that doesn't mean we'll only accept somebody who has experienced military-related trauma. We will accept any referral, but it might be that we have to find you another suitable service, or we'll try and do what we can in-house. We don't say no to anybody. But that being said, as I'm sure a lot of you will understand, society's getting more complicated, things are getting more complex. There are lots and lots of things going on, and actually what we're finding is, not all of the time, but it's sometimes less about service and it's sometimes more about people's childhoods. It's how they've been set up for life. And so sometimes that can require some really specific and long-term and specialised therapy. The other thing is resources for the geography that we manage. We've all talked today about how the East is quite a big region. I just want to put it into context for you. Currently, across the East of England, as a healthcare service, we have 10 nurses. So we have always around between 350 to 400 patients on our caseload. So for ease, let's say each nurse has 35 to 40 patients on their caseload. Now, in an ideal world, you would have one nurse that lives in Essex and all 35 veterans that live in Essex, and one nurse in Norfolk and 35, etc., etc. The split never works like that. That's an ideal world. And even if it did work like that, if one nurse lives at the bottom in Norfolk and a patient's at the top, they've got potentially a 2-hour drive up to see that patient for an hour and a half, 2 hours, come back again. So if you're looking at one patient a day, at worst case scenario, but you've got a caseload of 35 to 40, you don't even get to, there aren't 35 to 40 days in a month, you don't even get to see that veteran once in a month. So that kind of, again, just alludes to the fact that we're not supposed to be everything for everyone. And it also helps you to understand why we can't manage acute situations. We can't manage acute situations, we can't manage risk safely, and that's why local services are still really important. But we want to help that veteran bridge that gap to those local services. So the other thing as well is that a lot of our work is kind of done online. It's about 75% is online and by telephone, and about 25% face-to-face. Now again, you don't need to hear my opinion on whether I like that or not. It is what it is. But again, it just helps to give you a bit of context when veterans might come to us and say that the service didn't meet their expectations. That is because this is just the way the service is designed. We are trying our best with what we have. And finally, just sort of a little bit on the mental health versus clinical mental health versus well-being piece. So everyone has a state of well-being, and our state of well-being will fluctuate depending on what might happen in our life. But there's a difference between a clinical mental health disorder and a diagnosis and required treatment. Now, we get a lot of veterans that come to us as an NHS service that actually don't want treatment and don't need treatment, but they need help with other things that are affecting their well-being. So we get people a lot asking for support with things that we would call a secondary gain. That's not necessarily a bad thing, because if we can help improve their well-being, great. But it's, again, just to demonstrate to you what takes up a lot of our time, because you can't really get this help in many other places. So a lot of veterans will want to come to us for support with overturning Armed Forces Compensation Scheme claims. They want to make appeals and they want medical evidence for that. We get a lot of veterans really confused about the benefit system, and perhaps they've been turned down because, it's not in their nature to say how much they're affected by their condition. So sometimes they'll come to us and they'll ask for support with benefits. Same with housing, finances. Interestingly, we find quite a few veterans come through who are in disputes with civilian employers, and they'd like for our support with that as well. And we also, as we've mentioned earlier, in other forums, there's a small pocket of veterans that kind of struggle to move past certain identities that are helping keep them stuck, and have one foot healthily in the veteran camp and one foot healthily in the civilian camp. And we find that there are some veterans that do cycle around services and really have this dependence on services, and that can also be very, very tricky to manage. So, in terms of what we do and what our impact is, it's always helpful to see some numbers, again, to put it into context. So, Op Courage went live in April 2023. Since April 2023, so that is pretty much nigh on 3 years, we have had 1,839 veterans come through our door. Now, I know that's not as much as some of the charities here today have mentioned, but if you think about a specialist healthcare service in a region where we've got about 194,000 veterans, to have almost 1% of that population come into a health service, that's actually pretty significant. 48% of those referrals were self-referrals, so again that alludes to the fact that as Op Courage we try to be as visible as we can, we try to be as open as we can, we try to make it as easy as possible for someone to step forward. So you don't have to go to a GP and get them to refer you. And I think that is pretty telling that 48% of veterans feel comfortable coming forward to ask for help. 48% of our referrals, sorry. And again, just to give you a little bit more context, everything we do, every interaction we have with a veteran, every intervention we have, we record it. So in the last year, we have recorded 11,000 interventions with our clients. And that's just the ones we've recorded. I'm sure there's some that have slipped through the net as well. So again, for a caseload of about 350 to 400 veterans, and roughly 600 veterans kind of being referred a year, just in 1 year to have completed 11,000 activities, I think that's pretty good personally. In terms of kind of the three main areas that we work on, we will assess veterans coming through, as mentioned, we'll complete treatment if appropriate, and we will also support with their well-being. So we review every single referral within 1 day, and we have maintained that consistently for the last 12 months. We've reviewed in 1 day. And we've been able to offer it, it has fluctuated depending on veterans coming in and out. We've been able to offer a full nursing assessment within 9 days at best to up to 7 weeks at worst. That's still better than other NHS services. So we can always do better locally, but I still think if we compare it to what else is out there, I still think we're doing pretty good. Treatment-wise, we're very proud. We do not have a waiting list to allocate a veteran to a nurse. And same for our charity support workers, we do not hold a waiting list for that either. The wait list for psychology, again, fluctuates depending on resources, but the wait list has been at best 10 days and at worst 10 weeks, but again, damn sight better than what you would get in local services, so again, we're really proud of that. And well-being, as I said, because of some of those other things I mentioned, benefit claims, armed forces, compensation, that kind of thing. The other thing that we do find to be quite frustrating for us and for the veteran, the resolution for those things can be incredibly lengthy, and that again keeps that veteran just stuck, doesn't it? Of just kind of not being able to move forward. So just ending on some positive news then, and just to give you a little bit of an idea of where we're going in the next couple of years. We have just been given, nationally, the Up Courage programme has just been given plus 2 years on the contract. So, positively, that means that we are here nationally until March the 31st, 2029. Now, I know it's been alluded to earlier, everything's always up in the air, isn't it? We don't actually know what's going to happen after that, which is sad. We don't know if Up Courage is going to look the same, if it's going to be redesigned, if the services are going to come into more local divisions. But for us, we're just going to focus then on showing how much veterans need Up Courage in the next 3 years. We are going to focus on showcasing exactly what we're doing and why we need it. We've also just received a funding uplift in the East of England, which is fantastic. So when do you ever hear of NHS services getting more money? Well, you've heard it here. Because we've been able to demonstrate how much of an impact we're having on the veterans community and how much we're doing it on a shoestring, we have not given up, let me say that. I am like a little bull terrier, nipping at people's ankles consistently, and I've been doing that for the last 2 years, and we have finally been given a considerable uplift, which means that we can actually bring 8 new staff into our service, which is going to make a huge amount of difference for our veterans. So within that as well, we're also going to be able to deliver a little bit more of some sort of bespoke support for dual diagnosis. So dual diagnosis is veterans that have got a diagnosis of a mental health condition alongside an addiction, so perhaps to drugs or alcohol. Now, whilst we won't be able to treat drugs or alcohol, what we recognise is drugs or alcohol is often a crutch to help that person deal with perhaps service-related trauma, for example. But you're asking someone to take away a crutch to then get into trauma therapy. So what we are hoping to do is to have some more specialised support on board to help people get the addiction support that they need to finally get them into treatment, to get their lives to move on. And we're really excited about being able to offer that as well, because we know, as you all know here in this room today, we've heard some very, very sad cases of our peers in the armed forces community whose lives have ended too early due to, really, really difficult service-related stories, but then ultimately trying to cope with that with utilising drugs or alcohol afterwards. So that for us is super positive. So last slide here is just to help you, direct you to all of our contact details in case you want to get hold of us, in case you want to have a chat with us about a veteran, or just get a consultation perhaps, or just have a look at what we offer. Everything, including our referral form, is on our website. So this is what it looks like. You just need to type in Up Courage Essex or Up Courage East or Up Courage Suffolk into your search engine, and this website will come up. So we don't bite, we're always happy to help. We would rather have a conversation and make sure that the veteran gets through to the right thing. We try, as I said, to be different to other NHS services in that respect. we don't want to keep closing the door just because we're busy. So we want to help make sure that there are less steps, that there are less fights that veteran has to go through to get what they want. So if it is just a case of giving us a ring and saying, hey, we've got this person, don't know what to do with them, what would you recommend? We're happy to have those conversations. So yeah, I think that's all from me. Thank you for listening, everyone.